and buns. And then many of us may wonder that, is there any specific food or protein that can help us to boost our immune system and to help us to fight cancer better? But many researchers are actually interested in these questions, and they are still studying on it. So to date, what we know is that we do not rely on only one type of food or protein to help to boost our immune system. It is the combination which matters the most. So sufficient energy can help us to maintain or increase our body weight. And many times when we are sick, our relatives or friends mostly will give us some comments. So they encourage us to take more steamed food or soupy food. But at the same time, if we are taking food which is too bland, it means that our calorie content or our calorie intake will be lower. So therefore, we'll look at some ways on how to add in more calories to our food. So for example, when we're preparing porridge at home, it will be good to add in some unsaturated cooking oil. For example, it can be olive oil or sesame oil as an energy booster. And similarly, by adding in what we call this starchy vegetables, for example, like potato, pumpkin, and sweet potato, may also help to add in more calories to our diet. And we may put a thicker spread on the bread, enjoying fried rice or fried noodles instead of steamed rice or plain rice all the time. Fried fish, egg, or chicken instead of steamed fish or steamed egg all the time. Stir-fried vegetables instead of veggie in soup all the time, yeah? Yeah, and we can serve fruits with ice cream or even add milk or honey into our blended fruit, okay? So for example, avocado is a very good or high in calorie fruit. An avocado fruit, the calorie content is almost similar to a bowl of rice, yeah. So next we look at protein. So protein actually helps us to maintain and repair our body cells. So insufficient protein, on the other hand, actually can increase the risk of infection, cause nutritional deficiencies, and even cause a delay in wound healing. So examples of the high protein food, as we all know, meat, fish, chicken, egg, tofu, milk, and beans product, right? Okay, so what to do when you cannot eat? Sometimes we might find that the food does not appeal to you, okay? Or you may find that you are too tired or too nauseated to eat, or you may tolerate liquids much more better compared to solids. At this point of time, you may want to try some oral nutritional beverages. These are among the oral nutritional beverages that might be the common one that you might find in the pharmacy. And how do we use this kind of oral nutritional beverages? See, for example, our energy requirement is about 100%, but from your oral intake, maybe you're only able to manage about 70%. So the remaining 30% will be topped up from the oral nutritional beverages. However, to know which one is the most suitable for us, actually it depends on our medical condition, on our blood test results, on our energy and protein requirement, how much volume you are able to tolerate, and even pertaining to your taste preference, whether you like a milky taste or a juice-based flavor. So it is very important to know how much oral nutrition supplement that you need to take in a day and which one is the most suitable for you at this point of time. So you may want to consult your dietitian to get further information about these oral nutritional beverages. Yeah, so next we look at food safety and hygiene. So your immune system may be weaker during the treatment and you may be more prone to get food poisoning. So some of the suggestions are to avoid raw food, okay, those like sushi, half-boiled eggs, salad, coleslaw, right? Check expiry date of the packaged food, wash fruit and veggie thoroughly before cutting, and defrost the food in the microwave or in the fridge instead of leaving it overnight outside in the room temperature. And the meat must be cooked until well done. And during the recovery phase, normally the side effects that are affecting or impacting our nutritional and physical well-being will slowly begin to diminish or resolve. However, some side effects may persist longer. So normally, the patients may require an ongoing nutritional assessment and guidance during the recovery period. And patients with compromised nutritional status may require a continued nutrition assessment and guidance, including the nutrition support and the dietary education. And we shall take adequate amount of calories, protein, fiber, vitamins, and mineral. Choose more whole grain products. Maintain a healthy body weight, and choose foods which contain natural antioxidants. So this is the nutrition rainbow. It shows that different color pigments contain different antioxidants. So for example, carotenoids are abundant in orange color fruits and veggies, such as like carrot, sweet potato, pumpkin, and mango. And lutein may be abundant in green, white vegetables, for example, broccoli, cabbage, and cauliflower. Yeah. And so in a summary, we shall include food from all the food groups. Take oral nutritional beverages if you are unable to eat or unable to meet your requirement. And then speak to your doctor or dietitian if you are not able to eat well, and also if you are losing weight. And finally, is to maintain a healthy and balanced lifestyle after the recovery. All right, yeah, thank you.
Thank you, Ms. Wong. Please remain on stage for our Q&A session, and may I invite Dr. Satish and Prof. Chung to join us back on stage, please. For those of you who have any questions, please feel free to approach the standing microphones along the aisle. And then for those who remain to be seated, just raise your hand and we'll pass you a wireless microphone.
Thank you. I have a question for Professor Chung and Dr. Satish. Do you believe in turmeric or curcumin longer? Can this treat for the myeloma patient, or can we combine with thalidomide or lenalidomide? This is the first question. And the second, which way can we do to avoid the relapse after transplant? Maybe any relation with the food or beverage? Maybe.
I think the first question you can answer.
Sure. And the third question, what kind of sports is the best for us to do?
So the first question is asking about the use of curcumin and turmeric. Okay, so as you know, some of these things have been shown in the lay press or some publication that suggests that they may have anti-cancer effect. And it is true that these compounds have been studied in myeloma in the lab, showing that they may have anti-myeloma effect. But the problem is I don't think there has been any properly conducted large-scale clinical trial that shows that they are definitely going to be beneficial for patients. Okay, so if you ask me, should I include curcumin, turmeric in combination with the drugs that we use as a proposed treatment for myeloma, I would say no, because there's no evidence that it is truly helpful in the patient. We can always find things in the literature. You go on the web, Google, there will be personal experience. Say, hey, I have some condition, I take curcumin, it cured me. Everything under the sun can cure cancer if you go and read those the things. So what we can propose to our patients must be based on good and clear evidence, and I would say that currently there isn't very strong evidence to suggest that. But I would also never completely tell my patient, hey, you cannot take this completely. So what I suggest to patients is usually after they have completed their treatment and they're currently being monitored, if they want to take curcumin, just to see whether it can help prevent the disease coming back, it's their prerogative, but not when they're having any of the active anti-myeloma treatment. So that's the curcumin thing. There's currently no evidence. We do have researcher in the university that's working on curcumin's anti-cancer properties, and in fact, we have been thinking for a long time to try to design a clinical study to use curcumin, but it's not as easy as you think, because now we have so many active myeloma treatment, then it becomes very difficult to try to use these not so well-proven agents to complement, because it may compromise the patient's outcome. So that's the first question. Number 2 question. Curcumin and turmeric, same class, same thing, same answer. Exercise, right? Exercise.
Sports,
so, yeah. So exercise is one. I think the rest can chip in with the exercise. I think for me, there's no what you can and cannot do specifically just for myeloma. It all depends on the individual, right? And the risk period. So when you have the post-transplant period where the risk of infection is high, then I would usually propose not kind of exercise where you do out in the open like swimming or whatever, where you increase risk of infection. But when you're back to normal health, you can pretty much do most things that you want to do. I have patients who are triathletes, which do running, cycling, and swimming all at the same time. They pretty much go back to what they're doing once their risk of infection is over. And partly also depends on what you can take physically, So usually I suggest that because most of our patients are a bit on the more older side, to take gentle exercise. You don't need to be very vigorous. You go for walks. After your risk period, if you like to go for swim, if you have a private pool, you can swim. Those are gentle exercise that is good for the physical. You can do yoga, something gentle. Do Tai Chi Quan, like this martial arts, things that are not the vigorous type, Tai Chi or so on. So gentle, maintain the suppleness of the muscle, some level of physical activity will be good enough. These are reasonable activities for patients. Satish, you have anything to add about this?
Normally, after transplant, within 3 months, we say that if you're going out, wear a mask. And then if you're choosing to walk outside, choose times which is not crowded. So early morning or late at night when it's not crowded, weather is pleasant. But I think it's important to keep active, and walking is perfectly reasonable. But the timing should be chosen correctly, and don't go to crowded places. So, post-transplant, that's what I would advise to my patients. But otherwise, they sit at home and, they can lose their muscles and get demoralized. So, yeah.
There was a third question.
Which way can we do to avoid relapse?
Oh, what can we do to avoid floral relapse? Follow-up, closer follow-up.
After transplant.
Take medicine or diet, exercise?
All.
Okay. So I think, follow-up regularly is important. And then the other thing is, sometimes we do maintenance therapy after transplant. And this is meant to keep myeloma under a friendly control. I call it frenemy. So, you're enemy, but you're a friendly enemy. So you keep it under not too tight control so that it's stable. So sometimes we do that for people with, high-risk myeloma, but it's not advisable to everybody because it has long-term financial and other toxicities involved. So it depends on your response to treatment and your own personal disposition about what aggressiveness you want to take things forward. Some people are inherently more insecure. Some people are more, amenable to take watch. Some patients can be left alone without doing anything, and they might just be well. Even with a little M-band, they might not go up. Whereas some people with high-risk myeloma, even that little M-band might be, running before a next step of relapse. So, it depends on individual patient, but that's why it's hard to generalize. But in terms of, follow-up is more important than anything else, and make sure that, we check the things quite regularly.
So one of the common questions that, in fact, many patients ask me is that, is there something I should take or avoid in my food, or so to prevent the disease from coming back? Absolutely nothing you can do about food and so on. In a way, the disease comeback is depending on the tumor cells itself. We can give something like some drugs to maintain, but if you have a bad cancer cells, in a way, at the moment, there are very little things that we can do to prevent. Even if you give the patient drug, it will still come back early. It's just a matter of delaying it and so on. So in a way, it's a bit like what Mr. Gui said. You accept the disease you have, and you don't have to worry too much about, is it going to come back? When is it going to come back? You live your day every day thinking, is it going to come back every day? When is it going to come back? Is it going to come back today? Is it going to, you end up not doing anything, right? So it's like continue the treatment, let the doctor monitor the thing, and, just live your life as it is, right? The other the other questions that patient always asks is, hey, you tell me I've got high protein, then you ask me to eat protein, right? All the nice protein that I saw that slides and I said I want to be a patient too. I mean, this is good stuff, all the fried stuff and so. No. But, you know, the protein is different. The myeloma protein is not this kind of protein. The myeloma protein is the antibody protein that we make, you know. So you can take proteins. In fact, it's important to take proteins because it maintains your muscle bulk and all those things. You won't become so weak. So having a balanced diet, you can eat all sorts of things. Patients always like to ask me about food. As Chinese patient also, you know, usually the Chinese tradition is if you are not well, there's some class of food you cannot eat. If you have scar, you cannot eat jiangqing, the black sauce, because you get a black scar mark, you know, when you heal. I say, no, you know, eat whatever you like. No, there's no food restriction. The food doesn't prevent the relapse. You know, in a way, it's the disease. And all the work that we're trying to do is try to change the natural history of the disease. And sometimes we can, sometimes we can't. So, you know, you just come for follow-up, continue your treatment, and don't worry about the disease coming back. Paul?
Like catching infections like upper respiratory tract infection. Of course, it's all bad to get infection, but I've heard that people say that when you get an infection, it may stimulate your, you know, not so good immune system. And is there any correlation or any evidence that this actually stimulates the myeloma?
You mean to come back for relapse of myeloma? Okay. So actually, quite the contrary. You know, there are some studies which are looking at oncolytic viruses. What they do is to artificially change the mumps virus, for example, and give it as a vaccine. And then basically what it does is just like, you know, you are exciting the T cells to look for the cancer cells, and they will kill the mumps, but they'll kill the cancer cells as bystander. Okay, so you know. It can, okay, so in a way, you know, virus infections can in fact help, you know, treat myeloma. Although they are in clinical trials, I can't recommend that you go out and get a flu and that, you know, cure a myeloma. That won't happen. Because, I tell you why, because you're much more likely to get a bad flu and your treatment is delayed. Therefore, your myeloma treatment is compromised, right? So, you know, there are two sides to it. You know, one side is you looking at unique angles to target or stimulate T cells to kill myeloma. On the other hand, for most patients, if you get an infection during active treatment, that will result in suboptimal treatment because there is interruption and other things, and the pneumonia can flare up, and, you know, from a simple flu to pneumonia can happen. So the advice is that's why, you know, wash hands, you know, alcohol gel, avoid crowded places, you know, stay away from grandchildren if possible. You know, I mean, you know, physical touch, I mean, you know, because they can tend, you're 5, yes, so, because they, you know, if they're going to day center and all that, they can catch infection, right? So, you know, during transplant time, at least, I say do not, you know, or from time of collection onwards, you've got to be careful. Yeah. I don't know whether you have anything to say.
So, no, the immune system is a tricky thing, right? I mean, it can work for you, it can work against you. Certainly, you know, a lot of our treatment the new treatment that they're talking, in fact, is to activate your own immune system to kill the cancer cells. So if you get infection, your immune system may be activated, and, you know, I don't think there's any evidence to show that it actually makes the myeloma worse. What may likely happen is a delay in treatment that make the myeloma worse. And in fact, it is when the myeloma is bad. So which one is the chicken and which one is the egg, right? In fact, it's when the myeloma is not so well controlled, when the patient is needing a lot of strong treatment, that they are more prone to infection because their immune system is actually weaker. So, you know, I don't think there's a correlation. But clearly, you know, myeloma patients are prone to infection, more prone than others. And it's important to take care to prevent, you know, so, for example, going for flu vaccination and so on, you know, will help that to a certain extent.
Thank you. I would like to know about the maintenance therapy versus nothing. I mean, after the transplant, the drugs and maintenance therapy. The second question I would like to ask related with the food, because I saw a lot in the, internet about the food that you should avoid, like the raw sugar, which they said that it's not good for the cancer cell because it gives you the food and other things like the red meat, everything. Which one that I should follow because there is so many information in the internet. Thank you so much.
Okay, for the specific diet one, I will leave it to our dietitian to help a bit. But I would also just say that if you just follow everything you read on the internet, you don't need to eat anything, you don't need to drink anything, you don't need to go anywhere. You might as well not live, right? I mean, so just stay at home and look at the internet all the time. So, so I think it's very important to have all these things under context, because there's probably as much to say that you shouldn't take sugar as there is to say that you need to take sugar. Just like you know, it's both sides, right? And these things are all done. You must understand, it's all. They come about through, number one, in those studies that are well conducted, they are association. You know, so they do studies in many people, and then they found an association. And the association usually is quite weak, you know, which is why even recently WHO got into trouble when they say that, you know, you shouldn't take processed meat or something because, because the association is very weak. You know, it doesn't mean that all meat cannot be taken, all processed meat cannot be taken. You must also take into consideration, are we exposing the patient for a long time? Is this person taking processed meat for a long period of time, or is it just one time? Right? They never say all these things in the article. So we need to be careful, right? I mean, it doesn't mean that today you drink and you forget to add some sugar in your drink, oh my God, I'm going to get cancer. You know, no, you know, it's a prolonged exposure. Just like X-ray, right? I mean, the fear about X-ray getting cancer. So patients come and say, oh no, I don't want X-ray. You know, you tell me I need a scan. No, I don't want a scan, I will get cancer. No, you need to do the scans almost every day for months before you get cancer. So there are some things that become important that then suddenly patients say, I don't want to do because you tell me that I've got cancer, now you're going to do something to me that make my cancer worse. No, but we need to know where the cancer is to treat you, right? So, so I think these are important things, but whether there are some more additional specific information, my dietitian colleague may be able to help. But I don't think any of these have strong basis that you should completely avoid sugar, no sugar at all, nothing. It's not like that. Maintenance therapy is very tricky because this is this is very tricky because so for a disease that cannot be, well, we say generally cannot be curable. So the sensible thing would be that, well, if you can't cure me, you make sure you give me medicine continuously, like, you know, my diabetes where I need to take diabetic tablet all the time. I shouldn't stop it. I have high blood pressure. I need to take it all the time. I shouldn't stop it. And then logically, you would think that that's true. But actually, the funny thing is that the studies that have been done, very few of them, if any, has convincingly shown that if you give patients maintenance treatment, it will prolong the survival of the patient. All these studies shows that it will delay the disease from coming back. And that makes sense, right? If you take treatment, the disease will come back a bit later than if you don't take treatment, right? But there is no difference in the overall survival. What does that tell us? It tells us that, number one, those patients who take the maintenance treatment, when the disease come back, they are more difficult to treat. Okay? Meaning that they have shorter survival after the disease come back. Because overall, no difference from those that do not take maintenance. The disease come back early, but we can treat the disease that come back early also equally easily, right? And number two is that when the patients keep taking tablets, they don't feel normal completely, you know, they have some side effects, they have to remember to take tablets, you know, and I have many patients that once they really stop completely taking all the tablets, they really feel much better, they're back more to normal, right? And number three is that if you take continuous treatment, you need to pay the money, and if this drug is expensive, you know, it is a problem, right? So I think until we are very sure that the maintenance treatment definitely improves the patient's outcome, I would prefer the patients go onto clinical trial where they're getting the drug for free, where they are helping to generate the information that will guide us to know whether this benefit patient or not. If not, if there's no trials available and we want the patient to pay, then I will usually recommend the maintenance therapy for those that are at higher risk disease. So Satish have said, you know, high risk disease, we want to make sure that they maintain the disease so that it doesn't come back earlier. Those with low risk disease, with a disease that is not very aggressive, I will let the patient choose. I will tell the patient this is the information. Some patients, they have maybe a lot of money, so the money to them is not an issue, right? Insurance cover, so not an issue. But they're really scared that they have a disease that will come back early, then they take the tablet. But for others, the cost is a big issue, right? And they rather take their chances. They say that since you tell me that if my disease come back, you can treat again, I take my chance. I don't want the treatment, but you monitor me. When the disease come back, you treat me early. I think both are, viable options. So I think the important thing here is the discussion between the patient and the physician, understanding the risk and the benefit, and then you make a choice, right? I mean, for the high-risk patient, I don't want to give you that choice because I know that these are the patients that maybe I need to have tighter control, right? So that's my thinking on this. I don't know whether Satish.
I think also, broadly in line, because that's why we're doing this clinical trial. The other important thing is that quality of life is very important, and for some patients, coming off treatment is very important for quality of life. But for others, it's just the opposite. They feel that I need to be on top of my disease, and therefore I need to be on medicines. And the other important thing is that, generally speaking, for any myeloma, for that matter, any cancer, the first 10 years is a honeymoon period where you can preserve your quality of life. And after that, generally speaking, unless you are falling into the good risk group or lucky that your disease is under control, so we need to preserve that quality of life for as long as possible, because later on you get treatment-related complications and other things. So it's a fine balance, and I think that's why discussion with between patient and us is important. Not everything would work for everybody, but I think the first I personally feel that when I see patients who've been on treatment for 10 years and beyond, they come in wheelchair and other things. There isn't much of a quality of life. See, what are you paying this money for? So I think we need to think of quality of life, which is, I think, in my mind, very important because of it's a long-term disease.
Sugar.
Oh, okay. So to answer regarding the sugar, actually this is a common question by the cancer patients. So what do we say is that actually our body in the healthy cells and the bad cells both are actually eating the same food, which is the sugar. Okay, so although they say that because I don't take sugar because they are feeding the bad cells,